This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
Hi, everybody. My name is Claudia. I'm PGY 3 at Spaulding, and I'm one of the chief residents.
Hi, I'm HC. I'm a PGY 4 resident at Spaulding, and I'm one of the chief residents as well.
All right. Thanks so much for coming to listen in and learn a bit about the residency. We're going to go over, I'll go over some program, just basics, nuts and bolts, and then HC will talk about didactics. We'll go over some of the special tracks and highlights of the program, and then a little bit about all of us, and if we have time, Boston. This is Spaulding, or what we call Spaulding. It's the Spaulding Hospital in Charlestown. It's our standalone rehab hospital and where we spend a lot of our time. Spaulding is a 3-year program, so it's an advanced program. We have residents do all kinds of prelim and transitional years, but we don't have specifically an affiliated prelim year. We do have the benefit of working with a ton of fellows and having a lot of in-house fellowships. So you have sports, spinal cord injury, brain injury, an amputee non-accredited fellowship year-long program, and pediatric rehab that's split between Spaulding and Boston Children's, and then a number of other programs that are through affiliated MGB, either Brigham or MGH programs, including pain, neuromuscular fellowship, palliative care, and then there is a sports fellowship through Boston Children's as well that we had somebody, actually a current fellow now, who just graduated from Spaulding. People kind of match, varies by year, but all over the place. We've had a lot of people recently go into pain and sports. We've had brain injury, neuromuscular, SCI, and then I think important to highlight too, a number of people who've gone into general practice. And I think that just really highlights that people feel prepared to become an attending and go into practice and feel like they have the tools to do that. In addition to pursuing fellowship and getting support for really whatever your field of interest is. We also really benefit from being a part of the MGB network. So we rotate at MGH and Brigham, and Spaulding itself, our standalone rehab hospital, is kind of unique in that we are model system have the model system designation for traumatic brain injury, spinal cord injury, and burn. And so there's also robust research in all 3 of those fields, in addition to all of the kind of other research that's going on in different pockets around the system. We have 8 residents per class, so the total residency is 24. The images up on this slide are all taken from the main Spaulding Hospital, our inpatient facility, which is in Charlestown, technically Boston, but you can see the view of downtown Boston in the photos out on the water, which are some of the photos from the resident workroom itself. And then we rotate all over, and that includes at the West Roxbury VA, which is the inpatient VA for much of New England. The Jamaica Plains VA is outpatient, Boston Children's, and then a number of satellite outpatient sites, and Spaulding Cambridge, which is an LTAC with a brain injury floor specifically, and then also has skilled beds, and we have residents doing consults there as well. We rotate in addition to all over kind of through every specialty, and I'll go through a little bit more of this when we talk about the individual PGY years and what the schedule looks like, but I'll highlight that there's a disorders of consciousness program at Spaulding and the adult side of things, as well as on the pediatric floor. We have a dedicated pediatric floor within the Spaulding Rehab Hospital. And then we also have dedicated time for burn injury, prosthetics and orthotics, and amputee that's inpatient and outpatient. And then stroke, general pain, spine and peds as well. We do both inpatient and outpatient. So it's split up, I think, pretty well across all of the years. As a PGY2, you're doing most of your inpatient time. You're getting inpatient pediatrics, 2 months of inpatient spinal cord injury, 1 at Spaulding and 1 at the VA. You do stroke, amputee, inpatient, and then brain injury, and then it's split up pretty nicely, and you get a whole month dedicated to outpatient spine, a month dedicated to sports medicine, a month dedicated to neuro rehab, which is a really awesome month where you get exposure to a lot of spasticity, outpatient care, procedures, Botox, baclofen and pumps, and then recently we've had a couple of people become certified to do cryoneurolysis. So there is a new cryoneurolysis clinic that's a part of that month as well. As a PGY3, you do another inpatient month of spinal cord injury, a month of burn, and then a month of brain injury. You do 3 months of EMG, which is either at Brigham and Women's Hospital or at MGH. You do 4 months of outpatient. 1 is pediatrics, and then the rest are like a sports and spine focused, and 1 rheumatology month, which is also very procedural. And then 2 months of elective. And the elective, you get to really like create your own adventure because it does not have to be at or within like the MGB system. It can be outside of the system if you want to go elsewhere. And you can also incorporate non-clinical time, so like research time. And I think we have at least 1 person this year doing an international rotation as part of their elective. As a PGY4, you do a month of inpatient stroke, and then you return actually to the same unit that you do your spinal cord injury as PGY2, and you get to act as like the senior on a junior senior resident. You get to type service, you get to teach, and you also get to act as the attending. This is new as of this year, and a cool opportunity to really get to like go through all of the components of what inpatient rehab looks like as an attending, as opposed to a resident working under an attending. Which is run by our now retired program director, who still does inpatient spinal cord injury. You get sports and spine, and then a month plus of consults, more EMG at the VA. Again, 2 months of elective that are really a choose your own adventure, a month of selective, which gives you time to do LTAC at Spaulding and kind of other Spaulding specific clinical rotations, and then a month that's dedicated protected time for teaching, where you get to mentor and teach everybody else across all of their rotations and do a specific teaching curriculum as well. We are a standalone rehab facility, so we do have 24-hour call overnight at Spaulding. The first call you do is with a buddy, so you're walked through all the components of that, and you're really never alone because you can always reach out to your co-residents with any questions if things come up. Overnight, we do 1 month of home call at the VA, and then we have this nice short call system so that when you're inpatient, as like your primary team, you are done taking admissions after 5 p.m. And you're not there late because somebody is doing the short call like later admissions in the evening to kind of help everybody else's work-life balance. We do have a union at MGB. There are negotiations still ongoing. So as of right now, these are our current benefits and salary. There was not an increase from 2023 to this year while the negotiations continue. But we do, in addition to the salaries that are listed on the right, get a $10,000 annual stipend that goes towards things like childcare, technology, et cetera. We have 2% employer 401k contribution that does not require a match. It's just automatic. We have very, very, very low cost health insurance and really great educational funds So these numbers appear like the baseline educational funds, and then as a PGY 3 or 4, you get an additional like $500 for up to 2 conferences that you present at. HC, do you want to talk about vacation?
So we have 20 vacation days to use. This is only weekdays, so weekends are not counted. So you have basically a total of 4 weeks that you can use for vacation days. And then we have 5 additional conference days and 5 additional personal days. And these 10 days actually can convert into vacation days at the end of the year if they are not being used. So we have basically a total of 30 days we can use throughout the year.
I'll just highlight that these are not assigned, nor is the call schedule is assigned, but everything is swappable and flexible with residents. So you get to request vacation directly from the attendings who you're working with, and the services are not primarily resident run, meaning the attendings a couple months out of the year are there without residents because we have more floors than we have residents to staff them. So you are able to take vacation days and not need coverage, which gives like a ton of flexibility to take long weekends or middle of the week, or whatever is working for your schedule and your work-life balance.
So didactics, I'll try to cruise through. We have a protected time every Tuesday morning. We start around 8 a.m. and we finish around 12 to 1 p.m. During this time, you're excused from your clinical responsibilities. You will not get any pages. Each year, details are slightly different depending on academic chief resident style, but overall, we do have lectures mostly run by faculty members. We do have guest lectures, and we do have monthly ultrasound session that I will go over later. Next slide. Because PM&R works with a lot of other different specialties closely, we do have attendings coming from different specialties to give us lectures. And we, as you all know, we work closely with other physical therapy, OT, SLP. So these providers also come to us and give and share invaluable wisdom. And we have research curriculum as well as research track. And we have quality improvement curriculum. This year, I'm trying to focus more on board prep, and we do have resident finance committee and DEI committee, and the residents involved in these committees give valuable lectures. And this is our DEI committee, and they make sure they organize some events and lectures to cover all these topics. And ultrasound curriculum, I take deep pride in our ultrasound curriculum. We have a monthly didactic just dedicated to ultrasound. It's led by sports medicine attending, and sports medicine fellows come to help out with the small group sessions that we can practice. And you have an option to graduate with MSK ultrasound distinction if you pass an exam and complete a little coursework. And lastly, every year we have Anatomy Week in July, where sports attendings give us lectures on anatomy and physical examination. We go to Harvard Medical School cadaver lab, where we go over cadaver prosections. And this is when we actually get started on our ultrasound curriculum, and we really get hands-on with ultrasound starting from July of PGY 2 year. And then one thing I actually didn't go over was we do have lifestyle medicine curriculum that we're building, where residents can be involved in some of the work that can complete the requirements to be eligible for board certification in lifestyle medicine. And I feel like this is something that is very unique for PM&R residency. Claudia, you want to?
Oh, sure. Yeah, I could talk about resident continuity clinic. So Tuesday mornings, like HC said, are didactics, and that's protected time. And then every other Tuesday, we're split into 2 clinic groups that alternate, and you have protected resident continuity clinic time. So you are not required to be at outpatient or inpatient rotations during this time, responsible for admissions, anything like that. You get to focus on continuity clinic, and these are people who you'll see through all 3 years of residency. We have a system set up where you see patients with a PGY4 as a 2. And we have, returning patients who are coming for Botox, post-discharge brain injury, and we're working on expanding some of the MSK kind of new evaluations that we're getting in clinic. It will do joint injections, ultrasound guided, and the attendings are able to walk through those procedures, really do it dedicated for the people who you're following, which is really nice. HC touched a little bit on research, and we'll just throw up here, there is a new research track where you get dedicated research time actually taken out of some of the continuity clinic if you want as part of a research track, and they prepare you to apply for grants as a PGY4. We talked a little bit about the educational stipend, conference funding, and then those 5 conference days that you get regardless of whether you're presenting at the conference or not, for you to attend, like for your education. Actually spent a day at a adaptive sports coverage conference here in Boston for one of my conference days last year, which was really cool. It was like multidisciplinary with PT and everybody, and they're super supportive for whatever you want to use that time for.
5 minutes remaining.
All right. To kind of wrap up with some of the fun stuff, we have an awesome wellness curriculum. I'm part of the wellness committee. We have a pretty reasonable budget. We get to host a bunch of events every year and tailor it, bring back some of the favorites. We have a couple of photos up here from paddle boating out like along the Charles that we do in the kind of like at the beginning of the year, like a welcome event. We have like a welcome series this year too, where we're doing like sponsored bar snacks every other Tuesday for a couple of weeks in the summer, so that everyone gets to know the new PGY2s. We do a Christmas kind of gift wrapping event tied in with Ready that is associated with one of the local schools in the area. And then we've done pickleball, escape rooms. We all went out to a Red Sox game this past spring. And then we do a resident retreat, again, like a dedicated day where our program director holds the pager. You're excused from clinical responsibilities. And this year we went kayaking and had lunch out by the river. And I'll just highlight again, like I think it's really important for wellness that you get 5 personal days per year. These are days that you can take the morning of if needed, whether like you have an illness, a doctor's appointment, a family event, like whatever it is that comes up. So in addition to your 20 vacation days, your 5 conference days, and you have these 5 personal days to be used like last minute as needed, for a total of 30 days, off that you kind of can use as you need or as you see fit. HC also talked a little bit already about lifestyle medicine, but we have a ton of other extracurricular opportunities. We have people every year who work Boston Marathon, which is super awesome. And then there are tons of sports coverage opportunities for a whole range of sports, including dance, adaptive sports races, ice hockey. We have coverage at a high school level. There are some college opportunities, and then there are also some professional opportunities. And we have sideline concussion coverage with the Revs that one of our attendings does, and we'll bring fellows and residents on with him. We also have a fluoro spine sim days that are done with the fellows, where you get to practice with the equipment, which I think is really awesome. These are just a couple of photos of the building that we work in. Little more flashes of some of the views, and then a bunch of our residents who are really what make the program super special. I think we'll let people ask us about Boston later and take some questions, if any. I see one about where people live. So people live all over. I personally live in Charlestown. I think we have residents in Cambridge, down in Fenway, Back Bay, downtown, kind of in like the area called the West End or Beacon Hill, South End, and then there are a couple who live like a little bit more out in the suburbs, and we've had people coming in from like Newton or even like the more extended suburbs for those with families who need a little bit more space.
There was another question about signaling policy. Claudia, do you know anything about that?
HC and I didn't apply in a time of signaling. I am not sure. I would refer you to the like ACGME or ERAS policies. We don't have a specific signaling policy that I know of. And yeah, HC might be the better person to talk about the research track, but it is new. We'll be graduating PGY4s this year, who will be like completing the track, and you get every other Tuesday afternoon as dedicated time as a PGY4. As a PGY3, I think half of the year you get those dedicated afternoons. And then the research track is starting up this year in a sense where even before you are a resident at Spaulding and you're a PGY1 or an intern doing your intern year wherever across the country, you're connected with Dr. Dinesh Farr, who is the attending, who's running the research track, getting connected with research and getting started on your projects.
Thank you so much to Spaulding for their time this evening.